For decades, families and doctors across the U.S. have relied on the CDC's Advisory Committee on Immunization Practices, or ACIP, for vaccine guidance. This committee, made up of medical and public health experts, reviews scientific data and sets the nation's immunization schedule. Their recommendations shape which vaccines doctors give, when, and to whom, protecting especially children from serious diseases. The ACIP's process was designed to be transparent, rigorous, and rooted in science, earning it a reputation as the gold standard in public health. These recommendations influence not just pediatricians, but also school entry requirements and insurance coverage, ensuring vaccines are accessible to as many people as possible. For years, parents and healthcare providers trusted ACIP's evidence-based advice. This system has been a cornerstone of American public health, preventing devastating outbreaks and saving countless lives. But recent changes have shaken this foundation. The committee's membership and focus have shifted, raising concerns among medical professionals. What was once a predictable, science-driven process is now a source of controversy. The ACIP's purpose, to provide clear, reliable vaccine advice, is being questioned. Many parents and providers are left wondering where to turn for trustworthy information. This uncertainty threatens the very fabric of public health. On December 5, 2025, the ACIP held a meeting unlike any in its history. For 2 hours, the committee heard from Siri, a lawyer, not a scientist or doctor. Siri is known for representing clients who claim vaccine injury and for challenging vaccine manufacturers and government agencies. He has close ties to Secretary of Health and Human Services, Robert F. Kennedy, Jr., a longtime vaccine critic. Earlier that year, Secretary Kennedy fired all 17 ACIP members, citing conflicts of interest, and replaced them with individuals skeptical of vaccines. Critics say this move stacked the committee with anti-vaccine voices, turning a scientific body into a political one. Siri's prominent role at the meeting was seen as a direct result of this overhaul. Instead of scientific debate, the meeting became a platform for legal arguments and claims refuted by mainstream science. Siri has active lawsuits against HHS, including one seeking to revoke FDA approval of the polio vaccine. For many public health experts, his presence at the ACIP meeting represented a profound conflict of interest. The committee's credibility was suddenly in question. During his presentation, Siri challenged the scientific foundation of the U.S. childhood vaccination program. He focused on vaccines for hepatitis B, pneumococcal disease, and DTaP, highlighting alleged harms not supported by decades of research. Siri revived the debunked theory linking vaccines to autism, claiming a lack of studies disproving his specific definition. This tactic ignores the overwhelming evidence showing no connection between vaccines and autism. He also argued that childhood vaccines weren't properly tested in inert, placebo-controlled trials, overlooking ethical and practical reasons such trials aren't always possible. Siri cited an animal study to question vaccine effectiveness, misrepresenting its relevance to human health. The primary goal of vaccines is to prevent severe disease and death, not necessarily all transmission. Siri's arguments relied on selective evidence and sowed doubt, rather than reflecting scientific consensus. The global scientific consensus is clear: vaccines are safe, effective, and do not cause autism. This is based on decades of research involving millions of children worldwide. A 2021 review of 138 studies confirmed the MMR vaccine does not cause autism. Concerns about vaccine ingredients like aluminum have been thoroughly investigated. A 2023 Danish study found no link between aluminum exposure from vaccines and neurodevelopmental disorders. The hepatitis B vaccine's safety is also well established. In December 2025, the Vaccine Integrity Project reviewed over 400 studies and found the birth dose of hepatitis B vaccine to be safe and effective. Delaying the birth dose is not supported by scientific evidence. Medical organizations worldwide, from the American Academy of Pediatrics to the WHO, unanimously recommend routine childhood vaccination. The benefits of vaccinating children far outweigh the minimal risks. The science is clear, strong, and repeatedly confirmed. Siri's appearance at the ACIP meeting sparked immediate outcry from the medical community. Dr. Cody Meissner, a former ACIP member, called the presentation a terrible distortion of all the facts. Art Kaplan, a leading medical ethicist, criticized the meeting as an attempt to undermine childhood vaccination with ideology, not science. Some experts, like Dr. Peter Hotez, refused to participate, signaling that the ACIP had lost credibility among top scientists. Scientists directly refuted Siri's claims. Dr. Jake Scott from Stanford pointed out that hundreds of randomized controlled trials for childhood vaccines have used saline or sterile water as placebos. The meeting was seen as a platform for misinformation, not genuine scientific debate. The ACIP's new direction alarmed those who value scientific accuracy. The committee's legitimacy as a scientific body was now in doubt. The expert response was unified and forceful. The stakes for public health could not be higher. Critics often argue that vaccines must be tested against inert placebos to prove safety. But once a vaccine is proven safe and effective, it's unethical to withhold it from trial participants just for a placebo group. In pediatric research, this is especially important. Children are vulnerable, and researchers must protect them from harm. Modern vaccine trials often compare new vaccines to existing ones, not placebos, to avoid unnecessary risk. Proposing a study where thousands of infants receive no vaccines is ethically unacceptable. Vaccine safety is monitored continuously through systems like VAERS and the Vaccine Safety Data Link. These systems track millions of people and quickly detect potential issues. Ongoing surveillance provides a robust picture of vaccine safety, far beyond what a single trial could offer. The most immediate outcome of the ACIP meeting was a major policy change. The committee voted to roll back the universal recommendation for newborn hepatitis B vaccination. Now, parents of babies born to hepatitis B-negative mothers can delay or decline the birth dose. This reverses a policy that led to a 99% reduction in hepatitis B infections among U.S. children. The universal birth dose has prevented tens of thousands of childhood deaths from liver disease and cancer. Infants are especially vulnerable. If infected at birth, most develop chronic, lifelong infections. Universal vaccination creates a safety net, protecting every baby from potential gaps in screening. The new guidance reintroduces risk and complicates protection, despite overwhelming evidence supporting the birth dose. The decision appears driven more by politics than science, marking a dangerous shift. Federal actions have triggered a growing divide in public health policy. States like Illinois are taking matters into their own hands, creating firewalls against what they see as dangerous misinformation from the ACIP. Illinois passed a law allowing the state to set its own vaccine guidelines, independent of the CDC. Insurance companies must continue covering vaccines recommended by the state, ensuring access isn't compromised. A coalition of 15 Democratic governors has also voiced opposition, warning that politicized changes to the ACIP undermine public trust and threaten vaccine access. The national public health system is fracturing. For decades, unified CDC recommendations protected all children equally. Now a patchwork system is emerging, where access to vaccines depends on state politics. This confusion weakens the nation's defense against disease outbreaks. The ACIP's recent changes have eroded public trust in a vital health institution. For generations, the CDC was a reliable source of science-based information. Now, more Americans trust the American Medical Association for vaccine guidance than the CDC. This loss of trust is dangerous. Public health depends on credible institutions. Lower vaccination rates make communities vulnerable to outbreaks. Rebuilding trust requires a transparent, independent, science-driven process. People should turn to trusted sources: their doctors, the American Academy of Pediatrics, and the AMA. The path forward is a recommitment to science and transparency. Health experts and state leaders are calling for the ACIP's integrity to be restored. Protecting our children and communities depends on honest conversations, evidence, and trust in science.